As we know, the breast cancer is actually a leading cancer among Kenyan women, and breast reconstruction is an integral part of breast cancer treatment. So there are obvious benefits to the patient. It's a body restoration. It's not really aesthetic operation. It might be viewed by some as an aesthetic operation, but if you were a cancer victim or cancer survivor, you would understand that actually having a scar on your chest or missing that breast is a constant reminder of the experience that you went through, and actually having the breast reconstructed kind of closes that journey and allows the women to move on with their life. There have been studies as long as 15 years ago showing that the general well-being, integration to the society, health and psychological sort of impact on the patient is invaluable. I think when it comes to breast reconstruction in Kenya, the healthcare is moving very fast forward. It should become a standard fairly soon, because there is no difference between the patient in Kenya or in the UK or in the US, so the patient should be offered the certain standard of care, and if we say that this is standard of care, then the Kenyan patient should not be denied this form of treatment. I believe also, as unfortunately in Kenya the breast cancer affects a younger generation, these are women in the productive sort of period of life, and they would like to participate in the society. So moreover, actually, that with the changes in the Kenyan society and with better awareness of the patients and generally the changes of the general principles and evolution in the health market, now we should be concerned not only of the survival of the patient but also about the life quality and the patient's experience. And so in this context, the breast reconstruction perfectly fits and complements the treatment, where it's not anymore that you had a cancer and we removed it and you should be happy that you survived. That's not enough anymore. That may be been enough a few years ago, but now the patient are aware of other options and they can research on the internet, and not only because of that, but because the taboos are breaking down in the society and people are getting more open and people start talking about those problems. So actually the cancer prevention is another consequence of this, which would hopefully help everybody to diagnose the cancer early and start talking about it, and that would benefit the society as a whole. At the end, actually, it's about you. You need to feel happy to be able to fully recover from that extremely stressful experience as cancer diagnosis and cancer treatment is. And the breast reconstruction can help you to conclude that journey and move on, and there will be no difference between you and your other peers that haven't had their breast affected.